Hey guys, we're back with the last video of the breast cancer awareness. As usual, I'm Dr. Celestina and with me here is
Dr. Nina.
So today we're solely going to be doing the breast self-examination, where we'll be showing you guys how to self-examine your breasts to look for any abnormalities and some other extra stuff that we would like you guys to know about breast cancer.
Okay, so generally there are three positions in which you could do the breast self-exam. You could do it standing, you could do it sitting, or you could do it lying down. It's very important that you do the exam without your bra on, okay? And then always make sure that you have a mirror in front of you so you could see, you could have a reflection of yourself and actually see what you're doing, if you're doing it right or wrong. You also have to make sure that you know what you're looking for. Remember, we're looking out for lumps, or we're looking out for dry skin, or we're looking out for discharge, or we're looking out for the orange peel type of skin. So let's just make sure that we pay attention to what we're doing. It's not just about doing the movement, but you actually want to make sure you feel every part of your breast and look out for anything that could be dangerous.
So yeah, here we go.
Come with us.
So first of all, you have to stand straight in front of your mirror to observe the form of your breast, the shape, to notice any abnormalities in the skin, if you have a visible lump or a visible depression or any visible abnormalities of the skin of your breast. You have to also look at the region close to your collarbone, which is also very important when it comes to breast cancer. You also have to look at the region of your armpit, where you also have to check for visible lumps and, well, something that's not right. Any abnormalities that you know that wasn't there before, you have to observe or look out for things like that. Secondly, you have to put your 2 hands on your waist and also check for visible abnormalities like the lump or the dimpling or changes in the texture or consistency of your skin. The next step, you're going to squeeze your pectoral muscles, in this case your chest muscles, right, by also squeezing your waist with your hands. And then you also check for abnormalities like the ones that I've mentioned earlier, to see if there are things that were not there before, things that are not normal in your breast region. And next, you relax. Okay, so the next step, you raise up your right hand and put it at the back of your head. Then you take your left hand and you start to massage, starting from your collarbone down to your breast area in a clockwise manner. You can also go anti-clockwise depending on how you want it, but today we're just doing clockwise manner, right? You start from the places, the external places, and you go in a clockwise manner towards your nipple area, checking for lumps or any abnormal tissue you can feel. Then when you get to your nipple area, you have to pinch your nipples to see if there would be any discharge from your nipples. Now, when we talk about discharge, this is actually an exception for women who are pregnant or breastfeeding, because in such situations you can have discharge from your nipple, which is totally normal. So if you're breastfeeding or you're pregnant and you have discharge, do not worry. This is only for women who are not breastfeeding or who are not pregnant. If you notice this discharge when you're not in these conditions, then that's when you have to check that out. Next, you have to massage your armpit area, checking for lumps, basically lumps in this case. Then if you don't notice any lumps or see any abnormalities, then you're good. Then you have to repeat this same process on the other side, which is basically the same thing. You take your left hand and place it behind your head. You take your right hand and you start massaging from your collarbone down to your breast region in a clockwise manner towards your nipple, checking for abnormalities like thickening or a lump or multiple lumps. When you get to your nipples, you pinch your nipples, checking for discharge. When you don't have any discharge, then you massage your armpit area, also checking for lumps or any abnormalities. If you don't notice any abnormalities after doing this breast self-examination, then you're good. But if you notice any abnormalities like lumps, thickening, dimpening, a change in texture or consistency of your skin, redness, itchy skin or scaling skin, rashes, then please go to your doctor for further examination. So that's it for the breast self-examination.
Hey, so we hope that you've been able to learn from the video how to do your breast self-exam. It's very important that you know that you're not supposed to use a bra for this exam, okay? Please, please and please. But because it's YouTube and everybody is going to see this video, so we had to use a bra, okay? Modesty, okay? So generally you don't use a bra for this exam, and make sure you have a mirror in front of you. Do it sitting down, lying down, standing up, in any of these three positions, you'll be fine, okay? So next week we're going to be talking about high blood pressure, okay? Like they say in Nigeria, high BP. So many people are living with this disease in Nigeria and all over the world. So this is like very important for us to know how to live with this disease. So please don't forget to tune in next week. This is really important. I'm sure like every person has one family member living with high blood pressure. My mom and dad have high blood pressure. Her parents both have high blood pressure. Like almost everybody has high blood pressure. So this is a must watch for everybody.
It's
okay?
personal.
So please take it personal and tune in next week to watch our video on high blood pressure. Thank you for always supporting us. Don't forget to like, share, leave a comment, and please subscribe. Sharing is very important. We need you all to share the video, please, so that we can get across to as much people as possible. Okay, please. So thank you very much, and we'll see you next week.
Bye.
Bye.